In this video, I'm going to talk about why most people don't need voice surgery to achieve a feminine voice. Sounds too good to be true, but in reality, good voice therapy should lead you to achieve the goals that you want. The difficulty is there aren't many experts around, and it takes a bit of time and it takes a bit of commitment. And the other secret ingredient is confidence. So if you're in expert hands, the confidence should develop as your voice practice evolves. That's one of the reasons you go and see an expert and pay that money. But if the therapy isn't developing as you'd like, often the confidence doesn't develop as you'd like. And it becomes very tempting to consider voice surgery. Some people consider voice surgery even before they consider therapy. And many people think that therapy doesn't work. And that's not true, because there are thousands and thousands of cases that me and my team have assisted to change their voice, and it totally matches with their voice goals. Many people get in touch to ask me about my voice samples on my website, and they often think that surgery has been involved, but every single example on the website is voice therapy alone. Some achieved by me and some achieved by my team, who are all trained in the Antoni method and deliver the same program which delivers consistent results. So I invite you to listen to those samples, and there's a link for that below. But I really understand why people go down the surgery route, because I've been working with pre- and post-surgery clients as well for most of my career. The surgery's evolved, and in many cases now it's more effective. Time and time again, I see that people who do voice therapy first, then have surgery, perhaps because they're a little worried about their pitch sustaining, and then have the post-surgery voice rehab, always have better outcomes than people who don't have much therapy or any, and then have voice surgery, and then don't take the advice the surgeon often gives to have post-surgery voice therapy. I get it. It's because it's an added layer of work and expense and time. So whilst most people might not need surgery, some people will. And these are often people who have perhaps very bass voices and perhaps have a little difficulty hearing, perhaps have difficulty psychologically accepting any kind of voice change that they do themselves. Voice is quite a deep issue, so it will affect people in different ways. And lack of self-belief and lack of confidence also influences how voice progresses. And again, as I've said, that should grow in expert hands and guidance, and with doing structured therapy, it does take a little time. Nobody learns to drive a car or ride a horse in 2 or 3 sessions. But you can get really competent and have skills that last you a lifetime, say in 10 or 12 sessions, sometimes less. It's very individual. It depends on how you take to the therapy and sometimes the therapist. But if the method is very secure, then that journey should be a lot easier. And so many people tell me they're so surprised about how easy the voice therapy was compared to what they'd built up in their mind. All of us live on our fears sometimes and allow them to govern us. But in reality, they are just fears. And by trying to do something and learn something, often the change happens. It's probably true that the older you get, the voice therapy might be challenging. So for my more mature clients, it sometimes does take longer. So voice surgery can play an important role in some people's voice feminization. But it shouldn't be the thing that's considered first, because voice is not just pitch, and voice surgery for trans feminine individuals is mainly aimed at raising the pitch. But we know that aspects such as resonance and intonation and vocal confidence are crucial aspects of voices working successfully. In fact, without them and without a technique for using your voice without strain, voice surgery can cause more strain. So part of the therapist's role is to assist that not to happen. And learning that pre-surgery is always more helpful than trying to do it post-surgery when the whole of the vocal cords have been altered due to the surgery. So there's a role for always speech therapy pre- and post-surgery, or just speech therapy alone. I think specialist voice therapy is worth trying for voice feminization because it's much lower cost than surgery. And any skills that you learn will usually maximize any benefits you do get from the surgery. So if you know how to change your resonance pre-surgery and also not strain and remove croak from the voice, then any surgery you have after that will be maximized and sustained better usually because of the speech therapy guidance in advance. It also gives you a chance to practice voice with somebody and to develop confidence safely. Whereas sometimes having a voice surgery without that doesn't necessarily bring the confidence level up. One of my aims in this video was really to reiterate to people that voice therapy alone can be sufficient to feminize the voice and to help people achieve the goals that they want. I've seen it time and time again, but I understand how difficult that is to believe when you haven't seen it and you haven't had that experience, or perhaps you've had a negative experience. And it's so true that vocal dysphoria is sometimes so high in people, it almost scares them and paralyzes them into a quick fix. And a quick fix is often a surgery, or perceived to be a surgery. But a good ENT surgeon will always guide you to have some voice therapy first, and definitely after. If you found the advice in this video helpful and you'd like to watch more videos about voice, then give the thumbs up and subscribe to the channel.